Alright, this is my focused exam for the cardiovascular system. As I've said before, whenever I would do an assessment on a patient, I would not assess a patient with the shirt on. Purpose of this exam, I will be. I will approach the patient. I visually inspect the patient, check for any shortness of breath, any cyanosis, any problems like that. Let me see your hands. I'd check for the patient. Hands are warm, good blood flow, capillary refills intact. I'd check the patient's radial pulse, check for rate and rhythm, both normal. Check both radial pulses, check for any radial to radial delay. I don't have any. I check for a radial to femoral delay on the patient. We don't have any. Move up the arm, check the patient's blood pressure. Coming up, visually inspect the patient's face, looking for any cyanosis around the lips. Pull down the patient's eyelids, look for any pallor there, which would indicate to me any anemia up in your mouth. Look inside the patient's mouth, looking for any central cyanosis. Check the patient's dentition. The patient has good dentition. Turn to your left. Have the patient turn to the left, exposing the jugular vein. Look for any jugular vein distension, which we don't see any. All right, look straight ahead for me. I would listen to the carotid pulse, checking for bruit, both sides. No problems with that. Palpate the carotid pulse. Alright, as I said before, I'd have the patient would not be wearing a shirt. I would check for any scars, any visual signs that the patient had had any cardiovascular surgery in the past. I would check for any visual pulsations that I could see. Find the apex of the patient's heart, which is usually on the 5th left intercostal space. Move up till I felt the PMI, which is where it should be. I'd have the patient lie on their left side, which brings the heart as forward in the chest as possible, and listen at the apex. This would give me the best. That's the best position for you to hear any mitral stenosis. All right, have the patient roll back over and listen at the apex or the mitral. Tricuspid valve, pulmonary, and aortic. And at that point, I'm listening for any murmurs, any kind of extra or irregular heart sounds. Excuse me. All right. After that, I palpate all over the patient's chest, just like this, feeling for any heaves or thrills. Have the patient lean forward a little bit, check for any sacral edema, which is a sign of CHF. I come down and I visually inspect the patient's legs, check for any signs of vascular surgery there too, where veins have been taken or stripped. Look at the patient's feet, check their peripheral pulses, check for any skin changes in the legs, which could show poor venous or arterial circulation. And that's it.